Thanks for the introduction, and really I appreciate for this opportunity to give this talk at here. Today, I'm going to introduce about using social network in HIV research. I'm Weiming Tang from UNC Project China, and also the director of SAGE Global. For today's presentation, I will mainly focus on three parts. First of all, I will introduce the role of HIV transmission through social network. And in the second part, I will briefly mention how to understanding the social network. And in the third part, I will briefly mention what have been done in using social network for HIV prevention and care service. As you may know, a social network is a key part of our daily life. But what is social network? It actually means individuals linked together to form a structure by a particular behavior. For example, through sexual contact, through drug sharing, and through other behaviors. An important pattern for HIV prevention is actually the sexual network. Sexual network actually means people are linked together through sexual contact. So today we're going to talk about a social network intervention. So I'll give you some brief introduction about the social networking intervention too. It is actually a peer-driven intervention where the peers play the role of educators of HIV prevention information or health advocates and supporting each other to improve HIV prevention and the care service. So why we want to talk about social network intervention and why social network matters? Actually, HIV transmits through the social network, through the contact between different people. For example, through sexual contact, through drug sharing. And the patterns of intimate contact can have global effect on disease spread. And the network dynamics can have a significant impact on the level of disease transmission. I think COVID-19 would be a great example for this. As you know, social transmission is a big risk factor for COVID-19 transmission, and that's why social distance to reduce the social network transmission is a key strategy for prevent COVID-19. As we may know, members on the same social network often share the similar patterns, similar norms or attitudes or behaviors. And the individuals in the social network can be recruited or reached through social network because they are linked together through the social network. So in this way, intervention can also pass through existing social network. That's why we said HIV prevention can be initiated through social network. But what kind of strategies have been used for social network intervention? To be summary, there are four basic types, which is peer education, peer referral, peer supporting, and secondary distribution. Secondary distribution is a specific type of peer referral I was briefly introduced later on. So before we go to use the implementation of the social network intervention, we want to know the social structure or the social network among key populations. Actually, social network or work analysis is the main strategy that we can be used to understand the patterns of social network. It is a process of investigating social structures through the use of network and graphic theories. And it can categorize network structures in terms of nodes and ties, bridges, or links. The most collective social network is actually ego-central, the ego network. And the structure feature of ego network that are actually very limited. But however, it gives us some very important data regarding how to use the information on block missing patterns and relationship timing. Ego network can provide information on the relationship between the individuals, and usually it can form the local clustering. And we can know how many partners or people they have. And we also, through the social network analysis, we can know the relationship timing, the duration of the relationship, and how the overlap of the relationship. Of course, we will understand the risk of each relationship. Things that we in the later section will give us more detailed information about social network analysis. I will not go detail to this part, but instead I'll just jump to the social network for HIV prevention and the care service. One systematic review article actually summarized that social network approaches can be divided into 3 groups, which is social network analysis, responder-driven sampling, and the social network interventions. While I do not agree with this structure, but in the right side, it summarized that social network intervention has been used for HIV prevention and the care service, including diagnosis, care linked to care, and the retention, etc. So first of all, I'll introduce a social network for HIV prevention. As I mentioned before, actually HIV transmitted through the social network. That's why we don't want to use this social network for HIV prevention. Network intervention researchers has been used this to among different groups of people. For example, it has been used to reduce substance use among drug users. It has been used among men, women, MSM, female sex workers, and other populations for condomless sex reduction. Usually there was several steps for social network strategies. So first of all, for a social network intervention, we need to identify peers or peer educators or peer mentors and then recruit them. After recruitment, we'll give them substantial training on how to counsel or advise other members and how to transmit the knowledge to the others. In the third part, peer mentors or educators will deliver the intervention to the target individual in the social network after the training. So in this way, so they can develop a personalized risk reduction plan for participants, individuals. So for example, they can develop the structure for condomless sex reduction, substance use reduction, and so on. So regarding the use of social network for HIV testing and linked to care, the US CDC actually summarized the 4 phases of social network strategies for HIV testing. It is quite similar to what I have discussed before in the previous slides. Actually, in phase 1, it is called the recruiter engagement, which means we need to identify the key members or key influencers and then invite them to participate in the intervention. In the second part, which is engagement, is actually provide training or give enough information to the key population and ask them to go back to their social network to phase 3, which means they will deliver their intervention to the people in their social network and recruit them for HIV testing and encourage them for HIV self-testing. The final stage is actually initial testing in the STD clinics or HIV testing clinics. So in this way, if they are testing positive, we can further link to care for the tested positive people. And if they are negative, we can continue to encourage them for later testing if they continue to increase high risk. So I give you 2 examples in what we have done in China for the social network intervention for HIV testing. We actually called it the HIV self-testing second distribution. As I mentioned before, this is a specific type of social network intervention which involves index MSM to give multiple self-testing kits to their partners or friends for testing. So in this way, each index MSM can play as a key or seed to multiply and deliver the keys to other people in the social network for HIV testing. It is a great example in using social network to promote HIV testing in Chinese context. We developed this model by collaborating with the local CDC. So we developed a social media-based platform for promoting this strategy. First of all, an individual was invited to click a link on our website or on our WeChat account. So they will submit an application for HIV self-test kits. And in this way, they can receive multiple HIV self-testing kits by mail. After that, after they're getting the keys, the index MSM can distribute the keys to the others for use, and also they can use it by themselves. So after finishing the keys using, the participants either index MSM of the authors, the people who reached by them will upload a picture of their used kits to the system, so we can know that okay, they are actually doing the testing. We'll verify this through our develop the photo verification system, and in this way we can know whether index MSM tested or the authors tested, and how many authors were modified by the index MSM for HIV testing. We tested this among about 331 unique indexed MSM and 281 unique authors in 2018 and 19. In our model, each index MSM successfully promote 0.85 authors for HIV testing, and among of them, 264 are male authors. 60% of the authors are actually new testers, compared to only 21% among the index MSM. And of the 264 male authors, about 40% of them are actually sexual partners of the index, while the other 57 were not, which means HIV self-testing can be processed through social network, not just limited to sexual network. So in this year, we also tested laser strategy. We increased both secondary distribution and the peer referral. We conduct a 3-arm study to evaluate whether the monetary incentive and the peer referral can promote secondary distribution among Chinese MSM. This is a 3-arm RCT, while the middle arm is a control arm. It's actually the 3 as what I described before. It's a standard secondary distribution. In the mandatory arm, if participants, what I mean is authors, successfully promote an additional testing among authors, they can get $3 for incentive. In the mandatory plus referral arm, in addition to get the $3 incentive for each promotion, the index MSM can also share private link to up to 5 MSM in the social network for HIV testing. In this way, they do not need to physically contact the people in their social network. They can just share the link to the people in the social network for self-test kits application. So this goes beyond the physical way, and we recruited 309 people and randomized into 3 arms. Based on our just finished the trial, we can see that both the mandatory incentive and the peer referral successfully motivated more secondary distribution of HIV self-testing. For example, compared to control arm, mandatory incentive almost doubled the number of authors motivated by index MSM, and the peer referral plus mandatory incentive arm almost tripled the effect, which means each index MSM successfully motivated about 1.8 people for HIV self-testing. And they also motivated more people for HIV self-testing. Sorry, for new testers for HIV self-testing. So this from the 2 studies, we can know that social network strategies are actually very useful in promoting HIV self-testing in Chinese context. And we believe that this would be a useful and a very valuable strategy for us to further promote HIV testing, especially in the era of COVID-19, while facility-based testing was very limited. Besides social network strategy used for HIV prevention and treatment, HIV testing, they also were used for treatment, adherence, and virus suppression. The main strategy used for treatment and adherence are actually social support. As I mentioned before, social support is an important strategy for social network intervention. It is a consistent and strong predictor of healthcare utilization and medical adherence. This is also true for HIV testing, treatment, and adherence. For example, peer support programs are being developed and to promote HIV medication adherence in the US. And usually in a social network, the presence of specific network members are being associated with early initiation of HIV medication care in the US. This can be seen that actually peer supporting from the social network motivate the people to continually to use the treatment to maintain their health good. And the use of the existing relationships is more likely to be sustainable than developing a new relationship, which means index people or peer educators can just use their existing social network to promote the testing. They do not need to develop specifically to develop new social network for our intervention. Yet, it is likely that the effect of the both newly developed relationship and the existing social network will be specific and have a function of the abilities of current work to provide support for medical adherence. Thus, we do encourage people in different strategies of in different backgrounds to use social network strategies to promote either like treatment or the adherence through social network approaches, for example, social support. There are multiple kinds of social support. There can be couple-based support, it can be community-based support, or just social support. It's really can be categorized into different contexts and tailored for different population. So this is basically how social network intervention has been used for HIV prevention and care service. In addition, I would like to share some take-home messages with you. So as we mentioned before, social network is actually a very useful strategy in participant recruitment and reaching the most hard to reach individuals, especially in the area of COVID-19, while the facility-based testing is very limited. And the social network intervention is usually implemented in the way of peer education, peer referral, peer engagement, and peer support. And it leads to identify key peer opinion leaders and index individuals for intervention delivery. This is actually the key part of the intervention. Once we identify the key POLs and train them for our purpose, it can play a significant role in promoting testing and other HIV care services. Of course, social network it uses the social network to engage the participants in the of the individuals from the community towards the health good. Actually, social network, since we are linked together through social network, and the social network exists in every context, it can be tailored for different group of individuals and meet for different purpose. That's it. Thank you very much. Thanks for today's your time. Thank you.